A woman with a new diagnosis of breast cancer who comes here to the Mayo Clinic is met by a team of specialists, all of whom contribute to her care. We have dedicated breast surgeons whose role is to help make the diagnosis and then perform the initial surgery that is typically required for new breast cancers. Women will also see the medical oncologist, a person like myself. My job is to talk about treatments that we can give either preoperatively or postoperatively to reduce the risk for relapse of that cancer. That will include chemotherapy treatment and for some women also hormone therapy treatment to reduce breast cancer relapse risk. I should say that some women come to us with such small tumors or such a good prognosis related to their cancer that they don't require anything from me. They won't require any chemotherapy or any hormone therapy if their prognosis is so good that we conclude that their risk for relapse is very low. Also on our team are the radiation oncologists. In their practice, they use radiation treatments to reduce relapse risk in cases particularly where the cancer has been removed but the whole breast has not been removed. So our radiation oncologists contribute significantly to helping us reduce breast cancer relapse risk. We also have plastic surgeons on our team. Those surgeons will meet with patients either preoperatively or postoperatively to discuss options for breast reconstruction following their surgery. We have a genetic counselor on our team. Her job is to meet with patients to discuss the importance of their cancer diagnosis to their families, what that individual's breast cancer diagnosis may mean for the risk for breast cancer to develop in family members. We have a physical therapist on our team. Typically the physical therapist will meet with the patient after surgery to advise them on techniques that they can use to help their recovery process following their surgery. I think patients find the experience of breast cancer care at Mayo to be significantly different and I hope significantly better than what they might find elsewhere. Firstly, we use a team approach that brings all of the special expertise and knowledge to the patient in a coordinated fashion. The patient comes here to our breast clinic and can see numerous specialists that will be involved in her care over the course of their treatment. In other settings, unfortunately, to reach all these same specialists and receive the same type of care requires the patient to travel around town or around the medical center in a way that can feel disjointed and I think difficult for patients. By keeping all of the care centered and focused around the patient, as we can do in our facility, I think we provide significant advantage to patients, significant value to patients in their care. It also helps us to make the care precise and mistake-free and efficient when it can all be coordinated in one facility. Our ability to share the medical record, to share the X-ray images, the lab test results, and to talk amongst one another, physician to physician, physician to nurse, and so forth. All of that good communication that's built into the process here creates a distinct advantage for patients. And again, that would be in contrast to settings where patients would have to travel across town or to other parts of the office building and their medical records may not follow them. The knowledge that one physician has gained about their care doesn't necessarily follow them to the next appointment with the next physician. We tie that together, I think, in a very seamless way that makes the care efficient and effective for patients. Another feature of our breast cancer practice is the availability of clinical trials. Clinical trials are research programs in which we are bringing cutting-edge, new treatment opportunities for patients with breast cancer. These are often opportunities that don't exist elsewhere, don't exist anywhere outside of a research program. We have that research program here, and we try to make that available in some fashion to every patient that we see.